Welcome back. Chemotherapy is a life saving treatment for many Americans dealing with the effects of cancer. However, that treatment is linked to hair loss known as chemotherapy induced alopecia. Researchers at the Montefiore Einstein Cancer Center are testing a new specialized hair technique involving scalp cooling. Here to tell us more about this study is Dr. Beth N. McLellan, the director of Supportive Oncodermatology at Montefiore Einstein Cancer Center. Doctor, thank you so much for joining me.
Thank you. Thanks for having me.
Now, can you tell us about the Montefiore Einstein Cancer Center?
Sure. Our cancer center is located in the Bronx, and we bring a combination of science from the Albert Einstein College of Medicine with a team-based approach to cancer care from the Montefiore Health System. We've been a designated cancer center by the NCI since 1972, and our goal is to redefine excellence in cancer research, clinical care and engagement, and partnering with our community to reduce the burden of cancer, especially in people from historically marginalized communities.
For many cancer patients, chemotherapy can be a lifesaver. But for those who don't know, can you just talk about, what chemotherapy is and, what is the process when you undergo chemo?
Sure. So, chemotherapy refers to medications that are given to people with cancer with the goal of really destroying the cancer cells in the body. And many of these drugs that have been around for many years work by targeting cells in the body that are very rapidly dividing, the way cancer does. However, there are other healthy, normal cells in our body that are also rapidly dividing, including the cells that make up our hair follicles. And so we call the hair kind of an innocent bystander, that the chemotherapy is targeting the tumor, but it also is taken up by the hair. And that's why we see a lot of hair loss with many of these chemotherapy medications.
Now, I'm so glad that you brought that up because a common misconception is that, just having cancer causes hair loss. But you're explaining that that's actually not the case?
That's right. So most of the time when we see people with cancer who are going through treatment, the very severe, almost complete hair loss that we see is really related to the chemotherapy drugs. Although it's so common, we've come to really associate that look of someone with no hair as kind of defining someone who has cancer.
Thank you so much for clarifying that and explaining. Now, MECC is leading a new clinical trial aimed at fighting chemotherapy induced alopecia, known as CIA, with a new specialized hair technique during scalp cooling. Can you tell me more about this?
Sure. So scalp cooling is exactly what the name describes. We basically are keeping the scalp and hair follicles at a colder temperature while the chemotherapy medication is being infused. So by lowering the temperature of the scalp, the blood vessels that are there close up and constrict, and so less of the chemotherapy reaches the hair follicles, although it's still circulating through the body and able to reach the area of cancer where it's really targeted.
Now, I understand there is something called cold caps and scalp cooling systems. Can you just explain the difference between the two?
Sure. So scalp cooling refers to the whole process of keeping the scalp cold or cool during the chemotherapy infusion, but there's a few different ways to achieve this. So one way is using a cap that's kept in a freezer and placed on the scalp during the chemotherapy infusion. Another way, which is what we're using, is a device made by Paxman that's actually connected to a machine, and there's a coolant that's circulated through the cap so that cold temperature is maintained throughout the chemotherapy infusion without having to replace the cap. But all of those methods can be effective.
Now, can you talk a little bit more about alopecia? I know some people just associate it with hair loss, but I guess you can get it from different ways. Can you talk a little bit more about that?
Sure. So alopecia is really just the medical term for hair loss. And like you mentioned, there are many different causes of hair loss that we see in dermatology, and we treat all of them. So alopecia areata is a type of hair loss that is caused by autoimmune disease. So the patient's own immune system is attacking their hair follicles. We see very commonly hair loss related to age and hormonal changes in men and women. We see hair loss related to styling practices, genetic problems. But this study is really focused on the hair loss that we see in cancer people with cancer who are undergoing chemotherapy.
Now, I know we had a graph up about, different ethnic groups. Can you talk about, the ethnic groups that are mostly affected by this?
So we can see hair loss and all of these types of hair loss in people of any race or ethnicity. But we know that in certain races and ethnicities and backgrounds, people identify their hair as an important part of their traditions, of their culture, of their self identity, and often a link to their community. So, although we can see hair loss in any way, in anybody, we may see some people who may be more impacted by the hair loss in different ways.
Now, I want to talk about the cold caps and the scalp cooling systems. I know there's a focus on people who are dealing with chemo, but could this also help anybody who's just dealing with hair loss in general?
So that's a great question. Unfortunately, the way the cold capping works, it's really intended to prevent the chemotherapy from reaching the scalp. So we wouldn't expect this type of treatment to work in people who have hair loss from other problems. But I will say our knowledge and treatments for other types of hair loss have also been really advancing. And so if someone's experiencing hair loss from any cause, I really encourage them to seek out evaluation by a dermatologist.
Now, I want to look closely at this study. Can you just tell us a little bit about, who are the people you're going to be looking at? Just give us some more details about the study because we saw a few pictures already about what's happening. So, can you talk a little bit more about that?
Sure. So traditionally, the way scalp cooling has been used is people would wet their hair with water because the water helps the cold temperature to penetrate through their hair to the scalp where it needs to be, and then they would apply a thin layer of conditioner to help prevent the cap from sticking to their scalp. And the problem we've seen in a lot of the studies that have previously been done is that in people with naturally curly, kinky, tightly coiled or textured hair, when the hair is wet, it actually increases in volume and creates a barrier. So the cold temperature just can't reach the scalp where it needs to be. So we're adjusting that hairstyling technique before applying the cap. Instead of just plain water, we're having the women in our study really work a combination of conditioner and water through their hair. So it's not just the water alone, but really an emulsion of conditioner that's coating the hair. And then we're working with the women in our study to come up with a hairstyle that will work best for their hair type and what they know about styling their hair, with the goal of minimizing the volume of hair so that it's as flat as possible against the scalp to allow that temperature to get through. Those hairstyling techniques could include loose braids, twists, cornrows, whatever really works with that person's hair. We're really grateful and fortunate to have a hairstylist on site who's helping people style their hair so that they just have one less thing to worry about as they're going through their chemotherapy treatment.
I love that you brought that up. And even just looking at the way, different hair types react to water. I think that's so important. And I know recently we've been talking a lot about racial bias in, hospitals and just understanding that every patient is different. Can you explain, why it was so important to actually look at, something that may seem so small and how that could have a huge impact on the study?
Right. So I think this really highlights the importance of including diverse people, not only in the participation of the study, but also in the planning of the study, because I think most people with these hair types that are textured and curly and kinky would know from the get-go that this styling probably wouldn't work for them. So unfortunately, it's taken us to this point to get there, but we really hope that through the results of our study, we'll be able to offer scalp cooling to and make it effective for a much more diverse group of people suffering with cancer.
And I know there is also a focus on Black and Latina women. Would you say that's part of the reason why, or can you talk about, why there is that focus?
So at Montefiore Einstein, we definitely have a focus on serving our Bronx community. We actually include about 80% of patients in our clinical studies are from underrepresented minority groups versus about 8% in the rest of the country. So we're always looking for opportunities like this study where we're not only learning more about science and how to help people, but actually giving them the opportunity to participate in trials and to really improve their treatment and their experience with their treatment during cancer.
And I think that this is just a really amazing study because I know that you talked about having cultural styles helps boost someone's confidence. Have you noticed or heard of anyone deciding not to do chemo due to the fear of losing their hair?
Yeah, I think that's a great point that you bring up. So, in studies, we find that about 8% of women say that they would actually turn down chemotherapy due to fear of hair loss. Hair loss related to chemotherapy is usually rated as the number one most traumatic side effect that people experience during cancer. And we definitely do see people in our practice who decide to go with an alternative chemotherapy regimen that might be less effective for treating their cancer, but really just because they don't want to lose their hair.
Now, can you just let everybody know how they could learn more about this treatment?
Sure. So we are offering this trial to all of our patients at Montefiore Einstein. Scalp cooling is also available at other cancer centers. So I encourage anyone with cancer who is discussing chemotherapy to talk to their oncologist about the option of scalp cooling. Unfortunately, there's limited insurance coverage at this point, but there's some great organizations who can help with the cost and the logistics. And I think my hope is that all cancer patients have the option for scalp cooling if they choose to go that route.
All right, doctor, I just want to say thank you so much for joining me. I think this is an amazing, effort from your team. So I really appreciate you talking to us about that.
Thank you so much. We're really excited to get this study underway, so I appreciate your interest in it.
That's all for our show today. Thanks for tuning in. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always. See you next time.